If you are over 60, you know the fear. It's that sinking feeling when you walk into a room and forget why you're there. It's the panic when you can't recall the name of a lifelong friend. You dismiss it as just getting older. You worry secretly that you are losing your mind. And worst of all, you fear becoming a burden to the people you love. That fear is real. But I am here to tell you that the widely accepted belief that rapid memory loss is an inevitable part of aging is completely wrong. I know, because research shows the vast majority of rapid memory loss cases are not due to Alzheimer's or incurable dementia. In fact, up to 7 common causes of memory loss are 100% reversible or treatable. They are invisible killers often missed during routine checkups. These are problems that a simple blood test, a minor medication change, or a shift in habit can completely fix. This knowledge is your power. In the next few minutes, I will walk you through the 7 hidden culprits that may be stealing your memory right now. More importantly, I will give you the exact questions you need to ask your doctor to reclaim your cognitive independence. Stay with me, because the truth about your brain's health is far more hopeful than you realize. The invisible killers. Reversible medical causes. The first 3 causes we will cover are medical conditions that often mimic the signs of serious dementia. They are called reversible killers because once treated, your memory can snap right back. Number 1. The vitamin thief. B12 deficiency. Imagine your memory as a busy telephone network. Vitamin B12 is the crucial insulation around the wires that ensures every message gets through clearly and quickly. When you become deficient in B12, the signals slow down. Your brain cells struggle to communicate effectively. This can result in symptoms easily confused with dementia, including confusion, irritability, and profound forgetfulness. Why is this so common in seniors? It's not usually because of a lack of B12 in the diet. The truth is, as we age, our stomachs produce less acid and less of a protein called intrinsic factor. These 2 things are absolutely essential for your body to absorb B12 from food. It's an absorption problem, not necessarily a dietary one. The danger is that low B12 levels, if left untreated, can lead to serious permanent neurological damage. The good news: this is one of the easiest fixes. The solution is often a simple B12 injection or a high-dose supplement that bypasses the need for full absorption. It requires a doctor to order one simple blood test, a test that is often skipped in routine annual exams. If you are experiencing brain fog, ask your doctor for a B12 level check. It is a crucial act of self-advocacy. Number 2. The silent slowdown. Thyroid imbalance. Think of your thyroid gland as the master thermostat for your entire body. When this small gland in your neck is underactive, a condition called hypothyroidism, it dramatically slows down your body's metabolism. This sluggishness doesn't just affect your energy levels. It directly impacts the speed and efficiency of your brain. When your brain metabolism slows, you experience what many describe as brain fog. You feel mentally slow, sluggish, and depressed. You struggle to concentrate. You find it harder to recall words or follow complex conversations. For years, these symptoms were often dismissed as senility. But scientific studies confirm that an imbalance in thyroid hormone levels can produce symptoms that look exactly like early-stage dementia. The key insight here is that when the thyroid issue is identified and treated with medication to restore proper hormone balance, the symptoms of forgetfulness and confusion can often be reversed. This is why doctors must rule out hormonal imbalances before settling on a permanent diagnosis. Your brain's performance is directly linked to the chemical balance of your body. Number 3. The medicine cabinet culprit. Drug side effects. This is the most infuriating and often the most overlooked reversible cause of memory loss. Many of us over 60 take multiple prescriptions and over-the-counter medications every single day. But did you know that many common drugs, the very pills meant to help you, can be actively sabotaging your brain health? There are entire classes of medications known to interfere with memory consolidation and retrieval. These include certain types of antidepressants. They include tranquilizers and anti-anxiety medications like benzodiazepines. And critically, they include over-the-counter sleeping pills and some allergy medications, which contain anticholinergic agents. These agents block a critical brain chemical involved in memory. If you suddenly experience a rapid decline in memory or focus after starting a new medication, that is a massive red flag. It is not normal aging. It is a drug side effect. The solution is not to simply stop taking the drug. The solution is to immediately consult your pharmacist or prescribing physician to find an alternative drug with a safer cognitive profile. Do not ignore this. Check your medicine cabinet. Your memory may be just one pill bottle away from recovery. The lifestyle traps. Self-control causes. The next 3 causes are not typically treated with medication alone. They are driven by lifestyle and emotional factors that you, the audience, have the power to control, starting today. Number 4. The sleep thief. Sleep disorders. We have all had a bad night's sleep. But chronic, high-quality sleep is absolutely crucial for your memory. Your brain doesn't just rest when you sleep. It is actively sorting, consolidating, and cleaning up the memories from the day before. A good night's sleep acts like a mental housekeeping crew, transferring short-term memories into permanent storage. If your sleep is constantly interrupted by waking up to go to the bathroom, or worse, by an undiagnosed condition like sleep apnea, this critical process breaks down. Sleep apnea, where breathing stops momentarily, robs your brain of oxygen and prevents it from reaching the deep REM and non-REM cycles necessary for memory consolidation. Chronic poor sleep doesn't just make you tired. It actively prevents your brain from doing its job, leading to brain fog and an inability to recall information. The key is not just the number of hours, but the quality of that sleep. If you or a partner notice you snore heavily or stop breathing at night, talk to your doctor about a sleep study. This is a reversible memory thief that can be fixed with devices like a CPAP machine, instantly improving your brain's function. Number 5. The emotional drain, depression and stress. Many people in their 60s and beyond may experience memory issues that have nothing to do with brain cell death and everything to do with emotional exhaustion. Depression, stress, and anxiety severely compromise your ability to pay attention and focus. If you aren't fully paying attention to the conversation, the name, or the task at hand, your brain cannot encode that information into memory in the first place. This inability to encode memory looks like memory loss, but it is actually an attention deficit caused by emotional strain. Research clearly shows that depression often manifests as symptoms of dementia, such as confusion and forgetfulness. We often use the phrase brain fog, but sometimes it's actually heartache. It is a sign that your mind is simply overloaded and exhausted by chronic stress or untreated depression. You are not weak. Your mind is just over capacity. The good news is that when depression and stress are treated through therapy, light exercise, socialization, or appropriate medication, the ability to focus returns, and your memory function may improve dramatically. If you suspect this is you, acknowledge the emotional drain. Seek out a professional who can help you lighten that load. Your memory depends on it. Number 6. The hidden brain rot, alcohol and substance abuse. We must talk about the happy hour habit that isn't so happy for your brain. While moderate social drinking is often harmless, excessive alcohol intake over time is highly toxic to brain cells. Studies show that heavy, consistent drinking leads to difficulties in recalling what has happened, even in the short term. More dangerously, long-term alcohol abuse can lead to a condition known as alcohol-related brain damage. This is a profound form of memory loss that is preventable. While stopping alcohol use may not completely reverse severe, long-term damage, early intervention is critical. Reducing or eliminating alcohol intake can stop the progression of damage and allow the brain to begin to heal itself. This is not about judgment, it is about self-preservation. It is about safeguarding your ability to be present for the people you love. If you find yourself relying on alcohol daily, or if your family has expressed concern, please seek support. It is one of the most powerful steps you can take to reclaim your health and your memory. The vascular threat. Preventable systemic causes. These next causes are crucial because they show how systemic health issues in the body directly translate into memory problems in the brain. Number 7. The silent vascular damage, hypertension and cholesterol. Your brain is the most complex organ, but it is also one of the most fragile. It relies entirely on a steady, strong supply of blood to deliver oxygen and nutrients. Systemic conditions like high blood pressure, hypertension, and high cholesterol silently damage the tiny, delicate blood vessels that feed your brain. This is called atherosclerosis, plaque building up in the arteries, slowing blood flow. When blood flow is compromised, your cognitive function suffers. High blood pressure, often called the silent killer, significantly raises your risk of memory problems and vascular dementia. This damage is not inevitable. By actively managing blood pressure with lifestyle changes and medication, by controlling cholesterol through diet, exercise, and proper care, you are directly protecting the plumbing of your brain. Controlling these cardiovascular risk factors is one of the most effective ways to prevent the irreversible progression of memory decline and potentially ward off conditions like vascular dementia. This is how heart health directly translates to brain health. Conclusion: your memory is in your hands. We have just walked through 6 reversible causes and 1 preventable cause of memory loss. Issues that are often overlooked in the panic over irreversible conditions like Alzheimer's. You now know that your forgetfulness may not be a life sentence of decline. It may simply be a treatable symptom of a fixable issue. You hold the power to advocate for yourself. Here is your 3-step action plan to reclaim your memory health starting today. Action. Step 1. Review your medicines. Take the time this week to review every prescription and over-the-counter medication you take. Ask yourself and your pharmacist if any of those drugs are known to have cognitive side effects. Don't stop taking anything suddenly, but ask your doctor for safer alternatives. Action Step 2. Demand the right tests. Do not wait for a doctor to offer. Be proactive and request these simple, essential blood checks. Ask for a vitamin B12 level test. Ask for a full thyroid panel, TSH and free T4. These 2 simple requests can diagnose 2 of the most common and fixable causes of rapid memory decline. Action Step 3. Prioritize sleep and emotional health. Acknowledge the weight of stress and depression. If you are chronically tired, talk to your doctor about sleep apnea screening. If you are feeling overwhelmed, remember that treating your emotional health is just as critical as treating your physical health. Your memory will thank you for lightening the load. Remember the central truth. The fear of irreversible memory loss is paralyzing millions of seniors, but the truth is your memory issue may not be aging or dementia at all. It could be one of 7 simple reversible causes that the right tests and a simple diet change can fix. Now I want to hear from you. Out of the 7 causes we discussed, which one surprised you the most? And what is the one simple change you are committed to making this week to reclaim your memory health? Leave your commitment in the comments below. Finally, if you want to dive deeper into the number 1 dietary cause we discussed, vitamin B12, watch our next video on the most critical nutrient for brain function. Forget expensive supplements. 3 natural ways to boost vitamin B12 and fix brain fog. Stay informed, stay proactive, stay well. Disclaimer: this content is for informational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.